Hello, Dr. Markle of Centennial Schultz Clinic. Today we're talking about having a sprained ankle, what that means, some of the structures it damages, as well as common questions we get from patients as well as patients that have seen orthopedic surgeons is when do you need surgery for a sprained ankle? Now your ankle is comprised of some bones that connect together and they're held together by a bunch of ligaments. Now these ligaments end up getting damaged when you do sprain or roll your ankle. Now having a sprained ankle, we classify this several different ways. Depending on the ligament damage, you can have a grade 1, which is basically mild stretching of the ligament or some micro tears. You can have a grade 2, which is a large and yet incomplete tear of those ligaments, or grade 3 you can have completely torn. Now grade 3 you can further break that down into a completely torn tendon or ligament that is retracted or non-retracted, meaning it's still in good alignment or it's been completely pulled apart and off the bone. Now, how long does it take to recover from a sprained ankle? Now, if you have a grade 1 or grade 2 injury, typically this is anywhere from 1 to 4 weeks of recovery. If you have a more severe injury, such as a high grade 2 or grade 3, this can take 3 to 6 months of recovery on its own. Now, what are the symptoms of having a sprained ankle? Typically, there is immediate onset of swelling and pain around the ankle. Typically, it's located on the outside of the ankle. And then once you recover, sometimes the ankle becomes unstable, meaning rolling or spraining or repeat injuries to the ankle becomes much more prevalent. So some of the fastest ways to heal a ligament that we know of. Now, if you have a mild grade 1 or grade 2 injury, this can be accomplished 2 different ways. One, a simple prolotherapy injection, which is a hypertonic dextrose injection that's utilizing ultrasound guidance to guide the needle directly into the ligament to inject it. The next would be using your own orthobiologics such as platelet-rich plasma, which is a concentration of your growth factors that we then inject into the ligament that stimulates increased blood flow as well as stimulates your repair mechanisms to ideally getting that grade 1 or grade 2 injury back towards normal tissue. Now if you have a more advanced injury, such as a grade 2 or grade 3 injury, utilizing a stem cells or bone marrow contrite typically is indicated. If it's a high grade 2, sometimes you can get away with utilizing platelet-rich plasma to also improve your ankle pain recovery as well as the function of the ankle. Now let's take a brief minute to talk with a patient of ours and talk about their experience that they've had with platelet-rich plasma in his ankle.
Surgery. I had 3 ankle surgeons say we're going to we have to, in order to get you function, we have to take part of your hamstring tendons or bicep tendons or cadaver tendons and put them from this ankle bone to that ankle bone, and you're going to be off your feet for 3 months. 3 surgeons wanted to do that. 3 different ankle surgeons. And I come to Dr. Markle and injection once a year and 50% improvement.
Great.
80 and 99.
Perfect. Wow.
Pretty amazing.
Awesome.
My name is Paul Berger. I'm a medical doctor myself, but I've had multiple injuries to my ankle and to my wrist, so I've been coming to Dr. Markle for a few years now for PRP injections. And when I first came about 4 years ago, I could no longer run. I tried to walk with a golf bag, and every time I would twist, I would get sharp pains. And he did an injection that improved it about 50%. the first few months, and we did another injection the second year, and it was up to about 75 or 80% improvement. And then we did one more, and now I'm running on single track over rocks in the mountains, steep ups, steep downs, climbing, rock climbing, playing tennis again, which I just didn't have the opportunity to play tennis before, but now I can run back and forth and not have any limitations in my ankle. About once or twice a year I'll get a little tweak that I think, oh, did I cause some pain? I mean, did I cause some damage? But then I forget about it for months. So I'm still running on very uneven ground and not always in the best shoes. So it's pretty amazing that I can do a partial ankle twist and then have it resolved in seconds. That's just amazing that I can do all these activities again and have maybe 3 seconds of pain twice a year.
So thanks for tuning in. If you or anybody you know have been dealing with a sprained ankle that's not recovering, or have been told they need orthopedic surgery for that sprained ankle, feel free to give us a call. You can reach out to us on social media or give us a call directly, and we're happy to set you up with either in-person evaluation or even a telehealth evaluation where we can further discuss and evaluate your problem. Thank you. Have a good day.